Joshua Tomorrow, our Sergeant Dr. Mike Cruz, our Public Health Director, Art Sinavasi, our Public Health Chief Medical Officer, Dr. Felix Cabrera, our Public Health Chief Public Health Officer, Shima Mbakwan, and our Physician Advisory Chairman, Dr. Ho Wang. At this time, I'd like to give the floor to Governor Leon Guerrero for her remarks.
Thank you very much, Crystal. Good afternoon. I have repeatedly stated that I would not hesitate to reinstate restrictions to continue protecting our island. And today we have come to that point. Like the rest of the globe, our COVID-19 cases are on the rise. As we have reported, the Delta variant is here and the risk it poses to our community remains high. Last night, the Joint Information Center reported 82 new cases of the 1,056 tested. We've also seen a rise in our CAR score, now at 10.4. Our hospital admissions have also increased. On Guam, unvaccinated adults have a 30 times higher risk of needing hospitalization as compared to fully vaccinated adults. Additionally, the data has consistently told us that 90% of hospital admissions are not vaccinated. As of this morning, there are 20 COVID admissions between Guam Memorial Hospital and the Guam Regional Medical City. 18 of the 20 admissions are not vaccinated. 3 are in the ICU and 1 is on a ventilator. We are fighting a much different pandemic than we were a year ago. Today, we are battling a pandemic of the unvaccinated. In order to fully participate in society, you must do your part and get vaccinated. What we do as a community today will determine our fiscal and economic health. That is why, rather than impose a lockdown, we will impose a restriction of movement for the unvaccinated. The time is now. I urge each eligible person to get vaccinated, not only for his or her well-being, but for the well-being of our collective community. As we have seen elsewhere around the globe and in certain major jurisdictions in the United States, vaccination requirements are beginning to determine how society functions. Therefore, all those ages 12 and older will be required to show proof of vaccination to dine in at restaurants, bars, clubs, gyms, fitness centers, dance studios, movie theaters, food courts, sporting events, boat cruises, and other events to use the facilities or enter the premises. This is necessary because we know in these areas, mask wearing is compromised. For patrons, this provision takes effect Monday, August 23rd, 2021 at 8 a.m. For staff, this provision takes effect Monday, September 27th, 2021 at 8 a.m. To further contain the spread of the virus, we must also impose a limit on social gathering. That is why, effective Monday, August 23rd, there will be a social gathering limit of no more than 100 vaccinated people. And as always, the mask mandate remains in place. While there have been positive cases reported in our schools, public health data tells us there are no clusters among our student population. These cases originated from home, technology to make proof of vaccination easier, you can, in the meantime, prove your vaccination status by presenting any of the following.
Stand by.
Triste na kanta, gihilo mapagalis, iboti tumispasyo gisaro. Bonita na Palawan, kung bonito tati, iguinifiu, imumagain na pwede. Napalawan, usen baita.
Oaten House. Enjoy. I remember the old days with my friends.
To reinstate restrictions to continue protecting our island. And today we have come to that point. Like the rest of the globe, our COVID-19 cases are on the rise. As we have reported, the Delta variant is here, and the risk it poses to our community
Test it. Test, 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 test.
Yeah, I'm gonna cut back to your picture, Governor.
Is it working?
Yes. you're-
Okay.
Come on. Go ahead, Governor, you can take it down.
All right. We apologize. We will continue. I have repeatedly stated that I would not hesitate to reinstate restrictions to continue protecting our island. And today, we have come to that point. Like the rest of the globe, our COVID-19 cases are on the rise. As we have reported, the Delta variant is here, and the risk it poses to our community remains high. Last night, the Joint Information Center reported 82 new cases of the 1,056 tested. We've also seen a rise in our CAR score, now at 10.4. Our hospital admissions have also increased. On Guam, unvaccinated adults have a 30 times higher risk of needing hospitalization as compared to fully vaccinated adults. Additionally, the data has consistently told us that 90% of hospital admissions are unvaccinated. As of this morning, there are 20 COVID admissions between Guam Memorial Hospital and the Guam Regional Medical City. 18 of the 20 admissions are unvaccinated. 3 are in the ICU and 1 is on a ventilator. We are fighting a much different pandemic than we were a year ago. Today, we are battling a pandemic of the unvaccinated. In order to fully participate in society, you must do your part and get vaccinated. What we do as a community today will determine our physical and economic health. That is why, rather than imposing a lockdown, we will impose a restriction of movement for the unvaccinated. Again, we will impose a restriction of movement for the unvaccinated. The time is now. I urge each eligible person to get vaccinated, not only for his or her well-being, but for the well-being of our collective community. As we have seen elsewhere around the globe and in certain major jurisdictions in the United States, vaccination requirements are beginning to determine how society functions. Therefore, all those ages 12 and older will be required to show proof of vaccination to dine in at restaurants, bars, clubs, gyms, fitness centers, dance studios, movie theaters, food courts, sporting events, boat cruises, and other events to use the facilities or enter the premises. This is necessary because we know in these areas, mask wearing is compromised. For patrons, this provision takes effect Monday, August 23rd, 2021 at 8 a.m. For staff, this provision takes effect Monday, September 27th, 2021 at 8 a.m. To further contain the spread of the virus, we must also impose a limit on social gatherings. That is why effective Monday, August 23rd, there will be a social gathering limit of no more than 100 vaccinated people. And as always, the mask mandate remains in place. While there have been positive cases reported in our schools, public health data tells us there are no clusters among our student population. These cases originated from home, social gatherings, or out in the community. For that reason, there will be no immediate changes for schools. But again, the best way to protect our children, most especially those not yet eligible to receive the vaccine, is to surround them with vaccinated people. This must start at home. While we work to adopt the technology to make proof of vaccination easier, you can, in the meantime, prove your vaccination status by presenting any of the following: your hard copy CDC vaccination card, a photo of a vaccination card stored on your smartphone or electronic device, or a document of vaccination from your healthcare provider. Establishments must refuse service to patrons who fail to show proof of full vaccination, and the same applies to organized sports. Failure to do so will result in fines. As provided under existing Guam law for individuals, failure to comply with any guidance or directive issued by Department of Public Health and Social Services with respect to COVID-19 public health emergency shall be punishable. For the first offense, individuals shall be punished by a fine of $100. For the second offense, individuals shall be punishable by a fine of $250. For the third offense and each additional violation thereafter, individuals shall be punishable by a fine of $1,000. As provided under existing law for businesses and nonprofit organizations, failure to comply shall be punishable. For the first offense, businesses and organizations shall be punishable by a fine of $1,000. For the second offense, businesses and organizations shall be punishable by a fine of $2,500. For the third offense and each additional violation thereafter, businesses and organizations shall be punishable by a fine of $10,000. Again, we are fighting a pandemic of the unvaccinated. In order to keep our people safe, those of us who are eligible must roll up your sleeves and get those shots. Please protect yourself, protect the ones you love, and protect our community.
I'd now like to give the floor to Public Health Director Art Augustine.
Please go ahead and speak. Yes.
Thank you very much, Crystal. Governor, Lieutenant Governor, and everyone listening this afternoon. Today's executive or soon to be issued executive order is really in response and necessary to curb the transmission of COVID-19, the Delta variant, a highly transmissible variant. I am certain many who are listening to local, national, and international news have anticipated that it was just a matter of time for a shift to occur on our island. Our hope, due to the recent uptick in positive cases. In the past 30 days, July 20, 2021 through August 18, 2021, there have been 713 positive cases. The past 14 days, August 5th to the 18th, there have been 548 positive cases. And in the past 7 days, August 12th to the 18th, there have been 335 positive cases. Of these cases, each period, 30, 14, and 7 days, over 50% are individuals who are not vaccinated. Again, these are made up of individuals who are not vaccinated, the range being 53 to 56%. This percentage of those not vaccinated can change if we as a community come out to get vaccinated. The vaccines are safe and effective. It is a protective measure for those vaccinated and those who are not able to vaccinate. Also, recent cases have been households. For example, one household is comprised of unvaccinated grandparents, their adult child, and their grandchildren who are positive or experiencing symptoms. Without the vaccine, the family is even more vulnerable to severe illness. Therefore, the measure that goes into effect on August 23, 2021 is needed to curb the spike, to ensure that we do not strain our own fragile healthcare system, to stop transmission, to contain the spread of the virus. Before I close, I also want to share that earlier today, we did receive 18 results of our genome sequencing. There are variants of concern. 16 are alpha with no known travel. 1 is beta with travel and identified in the quarantine facility or TFAC. And 1 is a delta variant, also associated with travel. Thank you.
Thank you, Director Sinagasti.
Okay. So what we wanted to show here is just one graphic, and we'll put it up. So as the governor had mentioned earlier, as of right now, last report that there are 20 patients with COVID-19 admitted to VOMS hospitals today. 3 of them in the ICU, 1 of them on a ventilator. And so this graphic here is actually looking at from the beginning of 2021. So from January 1 up to August 10, as this data represents, as you can see here, 90% of all those with COVID-19 that were admitted were unvaccinated individuals. And so that's an important part to understand, because if you think about what percentage of the unvaccinated are right now on the island, first, we know that 18 and over, that there's right now about 82% are vaccinated. So these unvaccinated, they make up a minority of the population overall. And so you're talking more around like 22,000 of them. But yet, even though they make up 18% of the population, they make up 90% of the hospital admissions. So that's a major difference there. That's what we're trying to highlight with this graphic. And basically, if you look at the proportions, that's where we're getting the estimation of you are 30 times more likely to need hospital admission if you are unvaccinated compared to somebody who is fully vaccinated. Therefore, it is very much worth it, and we highly recommend that you get it as soon as possible, and that's so that you can as well not be subject to the limitations that this new executive order is implementing for very good reason. And as a friend of mine actually just said, that this is almost a PCOR 1 for the unvaccinated, whereas the rest of us can stay in PCOR 3 if we're fully vaccinated. Thank you.
Let me make a point.
Thank you, Dr. State Surgeon Dr. Mike would also like to provide a maximum.
Yeah, just a point on our fragile healthcare system. As I stated at the previous press conference, our healthcare system, that being the 2 hospitals, are already filled to capacity with non-COVID related illnesses. These are for patients that have either deferred or delayed their diseases or their care because of the last year's pandemic. Well, we've always said that the hospital is the last line of defense, and not, excuse me for using war metaphors as I wear a combat uniform, but the hospital is the last line of defense. The first line of defense is you, people of Guam. And you've done a great job with wearing your mask, social distancing, and your hygiene. But now there's one more weapon that you can use, and that is the vaccination. So we're pleading that those that are eligible for the vaccination, please go out and get this done and protect our community.
Thank you, Dr. Cruz. And now for our questions from our members of the media in the Zoom room. I'd like to call on Nestor Laquanto, KUAM.
Thank you, Chris. Up to everyone. Governor, is this restriction of movement indefinite, or is there going to be an end date, like say 2 weeks, a month, 2 months?
It is not, there is no end date right now. We are going to, just as we have in the past, Esther, we're going to put this action into play. We're going to look at the results in the next 2 weeks, 3 weeks. We will see what the data is showing. and then we will go from there. So there is no end date. I think it's a fluid action plan because we are going to be, again, looking at data to make further decisions.
Thank you. And you mentioned that the schools will remain the same for now, but what would cause you to make any changes to the school policy?
As you know, the school is really under the authority of our superintendent and the board. I do know that the school is working very closely with public health, and that the decisions made by Superintendent John Fernandez will be guided by CDC guidelines and will be guided with the advice of our public health. So right now, the data is showing that really the positives aren't really coming from the school, it's coming more from the outside. And so I am very comfortable, and so is the superintendent, on the protocols that they have implemented and established to try and, again, protect our children. But regardless, I just cannot overemphasize that the way to protect our children is to surround them with people that are vaccinated. So again, go out and get vaccinated so we can continue educating our children, so they can continue to do face-to-face education. As we all know, that that is the best way to teach our children, is through face-to-face with the teachers, their mental and social well-being with their friends. And that's what we really want to achieve here. Thank you, Nestor. Chris Barnett, the link. Chris?
Yes, hello.
We can hear you.
Okay, hi, Governor.
Hi, Chris.
Governor, can you repeat the list where the unvaccinated are not allowed to go?
Sure.
I'm sorry.
Hold on. I can provide the copy of, I already provided.
Okay. Well, Gov, because I didn't see like grocery stores and gas stations on there. Or
Yeah, well, the data and science shows that, they don't really mingle in the grocery stores long enough. We have seen that at an average, people may be there between maybe 15 minutes to an hour. So the risk of contacting the Delta variant there with the unvaccinated population is not as high as in those gatherings and those events that require longer interaction and longer, longer stay. The best way, again, Chris, is that, and please help us do this, and you guys have really been doing this from KUAM, is to message again the importance of wearing your mask. I think you in the media are very influential in influencing people's opinion and actions. So I know that you have at KUAM done a major campaign of mask wearing. I would like to see also that being placed for vaccination.
well, Gov, we have done many promotions and things about we have actually a promotion called the Vaccination. So we are definitely doing our part. But Gov, if you follow the international news, they're doing things like this in I want to say Europe, but it's leading to protests where hundreds of thousands of people who are vaccinated are showing up in support of the unvaccinated. How would you, I guess, comment on how this latest restriction is going to divide the community?
Our people's behavior is different from Europe's behavior. Our people's behavior is different from the United States. I think our people's behavior is more responsible. I think our people's behavior is more making sure that our neighbors are protected. I think our people's behavior is much more focused and targeted to public safety rather than individual rights. And so to compare us with Europe, I don't think is a very, I guess, adequate comparison.
Oh,
And I
I'm
can
sorry.
only say that for us here, our vaccination rate is high. Unfortunately, our unvaccinated population is most vulnerable. And they're the ones where we're seeing much of the positive cases. And they're the ones that we're seeing much more of the admissions in the hospital. So that would be my response.
Gov,
and,
can I just ask, I'm
also
sorry for,
I just want to say, I want to add also that Europe has more of the hospital capacity than we do here. Chris, we only have 2 hospitals,
I know.
and we don't have the luxury of going to the next state or territory. And I totally support Dr. Mike's comments about the fragileness of our healthcare delivery system.
Thank you, Chris.
Go.
Got that second round.
Okay,
Heidi, Kim.
okay.
Thank you, Chris. Heidi?
Good afternoon, Governor. You mentioned the
Afternoon.
penalties. Hello?
Yes.
Governor, you mentioned the penalties associated with non-compliance. Will there be additional GPD public health resources to be allocated to enforce this? And also, how many citations have been issued by DPH or GPD since the last press conference?
I'll give the question to Art, but yes, we realize that for this to be successful, we have to expand our capacity of enforcement. And they have. Just last weekend when is it 2 weeks now, when the sailors were all here. And I was very concerned about their compliance to wearing masks and so forth. The Department of Environmental Health and GPD together as a team went to every hotel to monitor and observe the situations there. And they will continue to do that throughout our areas here in Guam. And so, yes, we are going to be enforcing. We are going to be taking the businesses and organizations to be accountable for their, for their compliance to these directives. Art, you want to?
Sure, absolutely. Yes, I want to share with the community that environmental health actually has continues to partner with GPD. About maybe 2 weekends or so ago, we did compliance monitoring over at the beach side of our hotel row. And a week or 2 ago, also we did the cliff side of hotel row. In addition, we've also done monitoring at Guam Premier Outlet of both the food court as well as some of the stores, the establishments within Guam Premier Outlet. What is good to report at this time is that there was no non-compliance identified. So for those establishments, the patrons, as well as the operators along Hotel Row, both beachside and cliffside, as well as GPO, we want to thank them really for ensuring that their patrons and their operators, the staff are in compliance. And that's what the environmental health team identified. In terms of your other part, Heidi, with regards to since the last press conference, I would have to get that data. And if it's all right with you, I could send that to you later today. I don't have that data in terms of how many citations were issued since the last press conference.
Heidi, your follow-up?
Yes. So Governor, while GDOE said there's teacher shortage, what other recourse parents do parents have if they want to shift their children to online learning? Many really wanted to send their kids to school, but after seeing what happened the first few days of school, they really wanted to shift to online learning.
Right. Right now, my understanding is DOE does offer the opportunity for online learning. So if the parents don't feel very comfortable, they can do that. But again, in talking with the superintendent and in talking with public health, the protocols that we have, that they have put in is very appropriate and very adequate to helping minimize some of the spread and the transmission. But we all have our responsibility. And I know that the teachers there are really very good at complying with the directives, and they're very good at also working with the students to comply also with their mask wearing, washing their hands, and social distancing as much as they can.
Thank you, Heidi. Tony, K57?
So Governor, what does this do for tourism? I mean, are you now requiring then all arriving passengers, tourists, military personnel coming here for training to now no longer have a COVID positive, negative test, but also now require that they be vaccinated as well? Obviously, these tourists are going to be going to restaurants, going to various businesses around
Yes.
the island. So
They do not.
So beginning Monday, all tourist arriving passengers have to be fully vaccinated.
That's right. Or they do not go into the restaurants, and they do not go to the bars, or they don't go to the gym, or they don't go to dance studios. They have to follow, and the same with the military. They have to follow the protocols of the local government. I do know also, Tony, that Admiral Nicholson is also concerned about their DoD rise in cases. And he has informed me that they are all now being required to wear masks inside the base, whether indoor or outdoor. And he is also restricting their military personnel to go to bars.
Okay. Also, everyone has till September 27th to get their staff vaccinated. Does this also include, you had an executive order a couple of weeks back that required government employees to either be vaccinated or subjected to a weekly testing. So all government and Guam employees now have to be vaccinated by September 27th.
I think ours was September 24th.
Or 24th?
Yeah.
Okay, I heard 27.
Today's EO for staff of restaurants is September 27th because of the effective date.
Okay, how about government agencies then? Are you going to require them as well?
They are still, when we issued the directive or the EO, whatever that effective date, they should be fully vaccinated by September 24th.
Okay, so, but this is only for private sector, not for government agencies.
Which one?
Are you requiring also government employees to get vaccinated by the 27th of September?
Yes.
Okay, so it's all, both private and public sector have to be vaccinated.
Well, we are requiring restaurants and bars and those places for their staff to be vaccinated.
Okay, how about
private sector can follow suit, and I know some of them are, but we are not mandating private sector. We are mandating public sector, and we are mandating establishment that would we are mandating establishments that provide these services, that can be places of transmission.
Okay. So even government agencies, I mean, all the employees at Reventax have to be vaccinated by the 27th of September.
24.
Or get tested.
Or
Yes, or they get tested. They have to
Okay.
be tested if they're not vaccinated.
Tony will come back and we'll re-clarify that for you.
Okay.
Maureen Merity, MBJ. Thank you, Tony. Maureen?
Yes, good afternoon, everybody. So, if I'm sitting in the restaurant, I mean, how is GPD or public health going to, check that if I'm sitting in a restaurant, I'm vaccinated? Are they going to?
So it is really the business establishment that is going to require it. Just like right now, they require that you write your names on a piece of paper, your phone number, your login. They require your temperature to be taken. But now they are requiring for vaccinations, and public health is going to be able to review their records, and they can do on-the-spot monitoring. So I'll hand it over to Art, and maybe he can expand on it.
Sure, absolutely. Thank you, Governor. So the department is going to have access to the list, the contact list of those that are frequenting either perhaps a bar or a restaurant. What we will be able to do is retrieve that list and cross-check it with our WebIZs database to ensure that those that are listed. Now, one thing that will change in the establishments that are affected is that they're listing, all listings actually, that are all establishments that are maintaining a list. It's no longer a party of 5. Each person will need to be listed individually. And so that's just a minor shift in the process, but in the contact log, should you go to an establishment first, perhaps for dinner, it will no longer be Art San Augustine, party of 5. It'll be Art San Augustine, Chim Mbakwen, Governor Lilian Guerrero, and then the table number. And so we can do contact tracing based on that. We can also verify if all 3 of us who we say we're fully vaccinated are really fully vaccinated or not.
Okay, so thank you for my other question. So here we are Friday afternoon. These regulations are coming in Monday morning for patrons. So do you think it might have been reasonable to give our restaurants and affected businesses equally a week? I mean, do you have the public health regulations ready to go, or are they only going to be issued tomorrow? Because we have had those scenarios, right?
The public health regulations are already being drafted. And so I'm working with the Division of Environmental Health, and we are looking to try to get those guidance out issued as soon as possible. Our goal is no later than tomorrow. And
But that means businesses won't be able to act till tomorrow, right? Because everybody waits to be absolutely certain until they see the regulations. So effectively, on a weekend, if they come out tomorrow morning, you're putting businesses in a situation where everybody's got to scramble. I mean, unless you can tell me I'm wrong.
Maureen, the Guam Hotel Restaurant Association is aware of this. We've been communicating with them, and businesses are, this is not we're just laying it on the businesses today. There's been discussions with the businesses. Art has been meeting with Mary Rhodes from the Guam Hotel Restaurant Association. She's given him some ideas and input about the protocol and the guidelines. So this is a very urgent matter, and it needs to be effective immediately.
So in all fairness,
Back, Maureen, thank you. Joseph Taitano, EDN.
Afternoon, Governor. One question, as far as exemptions, are there anything being considered? We've had religious or medical exemptions. Is that going to be a thing continuing?
Yeah.
Yes, we will continue to recognize exemptions. For example, even the kids that are going with their parents to a restaurant.
that are ineligible, they will be able to go with their parents. This is for those that are eligible to be vaccinated. That is the requirement. And so again, like for example, the children of the parents who are under the age of 12, there is no vaccine available for that population at this time. Therefore, they will be exempt and of course, able to join mom and dad at the dinner table.
Right, and on that, as far as the requirement for public sector employees, I know there are exemptions in place, but if you have a religious exemption, a medical exemption, and you still have to get tested every day of the week, or every week rather, is that not the same thing as just deciding not to get the vaccine? Or is there anything materially different about that?
I don't think they have to take the test.
They're medical exempt, no. Yeah, that's right. Yeah, so yeah, the approach we're taking, for example, government agencies is that you have a medical exemption, yes, so we will not be requiring you, if based on medical, that you would not be, it's not our expectation that you would be taking a weekly test. If I get your question, I hope I answered that. Thank you.
Oh yeah, that's correct. I appreciate it. All right, I'll hold till the next round. Thank you.
Jerry Partito, PNC.
Yes, thank you. Governor, Governor, how will you address any possible legal challenge from, those human rights advocates who may say that this is a form of discrimination? What legal basis will you cite for this new policy?
The legal basis would be we are in a public health emergency, and we have the authority through the Organic Act and local laws to establish and implement these restrictions.
Okay, and also, Governor, the FDA is about to approve booster shots for everyone, not just the immune compromised. Are we prepared for, are we prepared to do mass vaccinations all over again? Will the UOG field house and will the guard be reactivated? And also, do we have enough vaccines for the booster shots?
You don't need to move it. They can hear you.
No, it's okay. You can go ahead.
Oh, you can go ahead.
You
Oh, gotcha. No, we definitely have courses of action that are already being planned for the anticipated booster shots that are going to be pushed out by next month. So there is a plan for that.
I also just want to add that President Biden has just extended the time for he just extended the orders for Title 32. It was expiring in September, but now it's extended to December of 2021.
That's for all states. All states.
All states and the territories.
I also like to share with you that just earlier today, we had a meeting within public health with our chief public health officer, our chief medical officer, and all the key leads for the response and the vaccine. We had our planning session, logistics, our nurses, our nurse supervisors, our nurse leads, and also just to discuss, to prepare for vaccine activity increase and what's ongoing today. So we are very much positioning ourselves to continue the vaccine clinics that we have in partnership with our guard, the gang. Also, we're now talking in partnership, in greater partnership with AMC and any other partners that would like to join public health and social services. Thank you.
Thank you, Jerry. Marvick, Pacific Island Times. Marvick, Pacific Island Times.
Can you hear me? Hello?
Yes, we can
Hi.
hear you now. Thank you.
Okay, hi. Hi, where do you attribute the sudden surge in infections? Is it mainly related to the lifting of social gatherings and occupancy rate?
Can I do it? You can just talk.
You can just talk.
We can attribute it to a lot of factors here. We're looking at a few clusters that we mentioned last week. We also talked about the Delta variant and the transmissibility of the variant. So these are key to what is going on now. But like we always said, vaccination is key, and we continue to urge people to get vaccinated. Thank you.
Your follow-up question, Marvick?
How about the arrival of unvaccinated DNV travelers? Does this contribute? Are there any noticeable COVID numbers coming out of the hotels and other businesses that cater to the tourists? Oh, and also the not to mention the military exercises that happened over the past 2 months.
I'm not tracking.
You might have to repeat your questions about
Oh, sorry.
Yeah.
Okay. All right. So, okay. What I want to ask is the arrival of unvaccinated DNV travelers, does it contribute to the increase? Are there any noticeable COVID numbers coming out of hotels that might indicate?
Can I just ask, are you asking, has there been an increase to local transmission based on the Airbnb program?
Yes. Does it contribute? Do they, are there numbers that indicate, are there numbers coming out of hotels involving employees that might indicate?
There's no data to support that.
Yeah.
There's no data to support that.
Thank you, Margaret.
Okay, cool. Thank you.
We're coming back around. Nestor, KUAM, any follow-ups?
Yes, thanks, Chris. Governor, I just wanted to revisit that whole idea of this indefinite because, as you know, there is a portion of our community that will find this onerous, to use a word that's been batted around recently. Is there anything that would cause you to remove this? For example, if the vaccination rate increased sufficiently, say we got to 90% or higher, would that make you change your mind on this? What would make you remove this?
They already asked it. No. They already asked it. Somebody already asked it.
So Nestor, again, we would look at the data in the next 2 to 3 weeks. If we start seeing our CLAR scores going down, if we start seeing our hospital admissions going down, if we start seeing our vaccination rates going up, then of course we will make the necessary decisions to again align with what we're seeing in the community, just like we have in the past since the last 15 months of this pandemic.
All right, thank you, Governor. And yeah, just one more, Chris. And so Art, I think you mentioned earlier that over the last 7 days, that 56% of positive cases were not vaccinated, but that still means that 44% were vaccinated. So I wonder if you could comment on that.
Okay.
Yeah.
Dr. Gurr would like to comment on that. Thank you.
And so I'll comment on that because I want to be clear that you can't just take those numbers as, saying that, it's about 50% of them are vaccinated and unvaccinated. The realization is you have to again look at it into what population do they represent. Now, as I mentioned earlier, the adults 18 and over, we're almost 82% fully vaccinated. And so if they're only making up around half of the cases or less than that, then that's something else that you have to consider. Whereas you look at those who are unvaccinated, they only make up 18% of the adult population, yet they're making up half of the cases. That's alarming. And so that only shows more evidence of that supports that getting vaccinated reduces your chance of being infected. We never said it was 100%, but it definitely reduces. And so we have the specific numbers to look at it also. If you are unvaccinated, to be infected, whether symptomatic or asymptomatic, you're 3 times more likely to catch COVID than somebody who's fully vaccinated. And that's just in general. And then as we mentioned earlier, if you, in terms of those who might need to be hospitalized, you're 30 times more likely if you're unvaccinated versus somebody who's fully vaccinated. And just one last part there is that I want to make sure that we also understand that this mandate for those who are, how this is going to affect is really, again, about 18% of the population. So I think a lot of businesses should welcome this requirement that's going to make the other 82% of the adults on the island more comfortable to dine in places where they know that everyone else that they're around is vaccinated and that they can comfortably take off their mask and take a bite and then put it back on.
Thanks, Doc. And I think the point, the main point which was made earlier is that if you are vaccinated, that really reduces significantly your chance of being hospitalized. Right.
Thank you, Ness.
Absolutely, yeah.
Because the governor is late for another engagement, I want to ask.
Oh, that's ridiculous.
No, Chris, you get a question. You get a question directly for the governor. We're going to go really quick, each person. So Chris, you get a question for the governor?
Thank you, Gov. Thank you. Gov, I'm speaking with key hotel and restaurant leaders, and they say that they weren't informed that you were going to implement this today, and they were under the impression that they were going to be given a month. I'm looking at a chat with one now, and they say it is impossible for any business to implement this at this time. You know, this being considered, Governor, you don't think it's a little harsh? Like, you don't want to say let the unvaccinated people dine outdoors or something?
I don't want to argue of, you know, he said, she said. I know for a fact that the director and even Chima met with Mary Rhodes, who's the head of the Guam Hotel Restaurant and Association. And so we are relying on her authority and her responsibility. The other thing is, the bottom line here, Chris, is we are seeing a rise in our cases. We are seeing a rise in hospital admissions. We are very concerned about the fragility of our healthcare delivery system to be able to provide the necessary services for those that are not COVID-related diseases. We are concerned about that. And I think as responsible leaders and as governor in charge of keeping our people safe, this is the action that I am taking. And I expect our business community to cooperate. I expect our public community to cooperate. I expect the private sector to cooperate because, hey, this isn't about you or me, it's about our whole community. That's the only agenda here, Chris. So, I mean that, or we just close off the businesses, and I don't want to do that. I don't want to do that.
Thank you, Gov.
Thank you, Chris. Heidi, do you have any questions for the governor specifically? We'll keep the rest of the panel here, but governor has to leave.
Okay, just Governor, can the unvaccinated or partially vaccinated, meaning those who only had their first dose, can they still be allowed to use a restaurant or a bar's outdoor space? Can restaurants or
No,
bars?
they cannot. They cannot.
Okay, thank you, Governor, for clarifying.
Thank you, Heidi. Tony, do you have any questions directly for the governor?
No, I probably public health can answer the question.
I'll come back for you then. Maureen, any questions for the governor?
Just one, yes. Governor, do you, how quickly do you think you can get the GIDA loan program up and running so there is helpful?
Yeah, it should be pretty quick, Maureen, because I think they already have the processes in place. So it's just a matter of transferring the funds over to them and having Mel and those guys work their processes. So I would say, I would venture to say within the couple of weeks.
couple of weeks to get the application guidelines out?
No, to get their money.
Oh, okay.
Thank you, Maureen.
Even better.
Yeah.
Joe Taitano, do you have any questions directly for the governor?
No, I don't have any questions for Gov right now. I'm waiting for public health.
Thank you. Marvick, any questions for the governor? Marvick, apologies, I cannot hear you.
Hi,
You're speaking.
can you hear me? Hi, hello? Hello, can you hear me? Oh, I'm sorry.
Marvick, we
Of
can
course,
hear
I,
you.
okay, first I have to apologize. I didn't realize my mic was on when I was having a private conversation, but I only have one question for the governor. Can you say that GMH or Guam's healthcare system is better prepared or better equipped to handle any medical surge this time than they were last year?
Absolutely. We've learned a lot over the last 15 months. And not only that, we have more of the treatment, the newer treatments. We are also able to have more of the ventilators, more of our facilities retooled to be able to provide the necessary space and necessary services. And the nurses are experienced more so. The doctors are on board. So yes to your question.
Thank you.
Marvick. Jerry, any questions for the governor?
Yes, just one question for the governor. Governor, the news broke this morning that Biden cabinet officials are, lobbying Congress for an extension of the unemployment benefits. And they said that they're going to use American Rescue Plan money. Can you comment on this?
I have not heard it. I will have to, track it. But I mean, if he's going to extend it, I think he should extend it with his own federal money separate from the ARP. And I will make that known to him. I will write him a letter to let him know that.
Okay, thank you. Thank you, Governor.
Have a good
I'd like to
weekend.
invite the panel to scoot in to occupy the middle seat. We'll resume with the rest of our panel, and I also want to remind our media members that Dr. Hoa Wen is also available to answer questions.